We're looking at friction reducing devices to complete tasks done in the bed. A non-friction sheet or a friction reducing device is a product that's used to remove friction and drag. When friction and drag are removed, it reduces the load and the exertion required for the healthcare worker. Most of our injuries we see occur with repositioning in the bed. So this is the perfect product in a safe patient handling environment. In this clip, we're going to watch how a patient is moved up or down the bed with the non-friction sheet. Applying the non-friction sheet doesn't require turning and positioning. It's easily applied under the patient without having to turn and roll them, and that is the benefit. When the non-friction sheet is in place, it has a specific direction that it's applied in for the job it's going to do, and the non-friction sheet is never left under the patient after the task is done. When the task is done, it's removed. Remember to use the bed controls to put the patient in the best position for the task. With the bed in the best position for this maneuver, with the knees higher than the head, the patient will flow easier up the bed. So by elevating the knees, the patient can move. The body mechanics that we want you to look at in this clip are that you're standing very close to the bed, you are in motion, stepping solidly forward in a gliding motion. If you were to stand still and push into the product, you wouldn't get the same effect. So what you're seeing is that gliding motion. When conducting a lateral transfer, you can use more than one non-friction sheet. The non-friction sheet again is applied without having to turn and roll the patient. The direction of the sheet now has the closed ends running along the side of the bed, along the side of the patient. So the sheet is positioned in the position necessary for the task. And in lateral transfers, you're going to move the patient out of their bed onto another surface. You can bridge the gap with a slide board, or you can bridge the gap with a pillow. Very important that both devices are locked in place for the transfer. Using a transfer board helps make a smoother transition. It's more comfortable for the patient and it's safer. You'll notice in a lateral transfer, in the old way, you used to overreach, climb up on the bed. Sometimes healthcare workers had one foot on the floor, one up on the bed. In using a friction reducing device, you have the potential to push to start the maneuver and pull to finish the maneuver. When you push, it's an easier ergonomic task than pulling. It's very easy to apply a tri-turner to a patient who's in bed. The tri-turner can be put under the patient with the use of the non-friction sheet. The tri-turner fits under the patient at their low spine, top of butt. The positioning of this sling is to help you turn the patient and still have access to their bottom. When we think of the number of times we turn and position a patient, we're looking at a safe patient handling tool that will mechanically turn a patient and allow us access for bathing and toileting, wound care, or a treatment. The tri-turner has Velcro straps that anchor on both sides of the bed so that the tri-turner can stay on the bed. When it's going to be used, the tri-turner is released on one side and attached to the lift. The tri-turner is anchored on one side, released on the opposite side. The tri-turner can be used on a portable ceiling lift, a fixed lift, or a floor lift. When the tri-turner is connected to the motor, it will mechanically turn and roll that patient. Once again, you have a safe patient handling tool that will turn a patient mechanically, and it will also keep a patient over that may be startled or combative or someone who does not like to be turned and touched. Patients report that the use of this equipment is comfortable. If you have to turn and position a patient on their side for pressure relief, you can turn them, stick a wedge behind their back to hold them over, and then release them from the motor. The convenience of keeping it on the bed so that it's there when you need it is a big plus to a healthcare worker. Turning and positioning is a task that is done very frequently for any kind of care, any kind of bed panning in the bed. As we mentioned, high risk for injury for the healthcare worker. So turning and positioning is loaded with repetition. The non-friction sheet is going to be used to turn and position this patient. Again, you're going to see how we load it under the patient without being forced to turn that patient in order to get it under them. The bed's nice and high. The body mechanics are you're very close to the bed, 1 foot forward, 1 foot back. In order to turn somebody, you're communicating with your partner. You're doing the count of 3, always positioning that patient in a side-lying position, ready for the turn, crossing the feet or crossing the knee. In one smooth motion, one person is going to push into the non-friction sheet while the other one starts to pull the non-friction sheet. And in one smooth motion, with the side rail up, the brakes on the bed, a pillow possibly near the side rail to protect the patient, you can turn that patient onto their side. Let's talk briefly about the benefits to the patient. Every time a friction-reducing device is used, the patient's skin integrity is not compromised. The skin integrity is actually improved. A non-friction device takes away the potential for shearing and friction on the very fragile layers of skin. So the benefit to the patient is the same benefit to the worker. Non-friction devices remove friction and drag and protect the patient at the same time. Notice here, when you remove the non-friction sheet, you don't disturb the position, you just put your patient in. And so that's a great benefit too. It comes out from under that patient without having to turn them again, and you can see it's pushed through on one side and easily pulled out on the other side. That motion is with your whole body, not just tugging at it, and the patient stays in the position you put them in. The non-friction sheet can be used for in-bed exercises. Range of motion to the uppers or the lowers can be accomplished with the use of the non-friction sheet. The benefit to the patient is improved skin integrity. With friction reduced, the patient resident can move their limbs much easier and have less friction, thus improving their skin integrity. Exercises to the lower limbs are very important when you're working on getting a patient resident back to weight bearing, back to standing, back to walking. That patient benefit to range of motion improves their skin integrity, and it also will impact their length of stay. With a non-friction sheet in place and the bed positioned, the patient is cued in active range of motion. The cueing is with the caregiver's hands, but the patient is doing the exercise. You can do passive or active assistive or active range of motion using the non-friction sheet. With this ability for the patient to move before they get out of bed, with improved circulation being the benefit, you're going to get an improved result to weight bearing and ambulation treatment. Once again, it's useful for rehab nursing goals as well as therapeutic goals. A range of motion aid, a CNA, a PCA, or a nurse or therapist can use this technique to get a patient ready to move and get a patient ready to bear weight.